Good evening, everyone, and welcome to the Modern Management of the Older Adult podcast. My name is Dr. Trissa Hutchinson, occupational therapist, and today I am here to talk to you about looking at your patient's feet. Yes, I said it. I want you to look at your patient's feet. Now, where are we going with this? Why do I want you to look at your patient's feet? First off, there's a lot of things we can learn. But let's dive into where this kind of came about in terms of an experience I recently had with one of my patients. She is an older adult individual. She's had multiple THA revisions. She has scoliosis. She ambulates with a walker and has a history of many falls. We had been working together for about 4 or 5 weeks, and she was getting much stronger, feeling better, but she was explaining to me that every helped her a lot with her independence, but it never really killed the pain 100%. And it was confusing to me. And so after a little bit further conversation and diving into what was going on, my patient tells me, well, actually, Trissa, I have this thing on the bottom of my foot and it kind of hurts. So anyway, I asked her to remove her socks and shoes, look at the bottom of her feet, and she has a very large callus or hardened area similar to a corn right on the bottom of her foot. And every time she takes a step, that hardened area is actually sticking out from the bottom of her foot, and it alters her gait pattern. And the pressure of that just hurts in general and sends that sharp shooting pain. We got her hooked up with podiatry. Podiatry came in and took a scalpel and literally just cut that thing right off. And she told me her pain was instantly gone. Instantly pain-free by having that hardened area just cut off. Did we discharge at that point? No. We still had a lot of functional goals, strength, and progress to be made. But now she was doing all of that pain-free. So let's talk about why should you look at your patient's feet. There are a lot of things we can learn aside from just potentially reducing someone's pain because there's a hardened area like my patient. During your eval, I want you to think of a lot of if-then go-tos when it comes to looking at their feet. So when you ask your patient to take off their socks and shoes, you can first assess their physical ability to do so. Okay. When someone has to take off their shoes and their socks, you can see, can they actually reach their feet? Can they see their feet? When you're looking at their toenails and you can see how they're taken care of, can they see that? If they have laces, how's their fine motor coordination when they're trying to do that? Can your patient feel their feet as well? Okay. These areas are kind of our jam in the physio world. Assessing the patient's ability just by watching them actually do the action of taking off their socks and shoes or putting them back on. If someone has compression stockings, that might tell you a lot about how they're able to manage their compression stockings, because those things are hard. They're tough. They're tough for us to put on our patients. Now imagine being the patient. So physical ability. Number 2, you can assess and I get a screen, I guess, of someone's cognitive processing by asking them to take their shoes off. First, you can see, can they comprehend the command or the cue that you gave them asking them to do that? So do they understand the request? Do they know they need to take their shoes off and then their socks? Do they know the sequence? Can they manipulate? Can they understand how to unfasten or fasten their laces or snaps or zippers that are on their current shoes? And it also triggers their cognitive awareness of safety. I have a lot of patients who, if I ask them to take their shoes and socks off, I've had them attempt to do that while standing, even if they have very poor balance, and they've actually fallen back into a chair. Now, I was anticipating this, and so they were in a safe environment, and so they just landed in a chair. However, that was a trigger for me that their safety awareness is low. This also, just by looking at their socks and shoes and how they can, or looking at them take off their socks and shoes, gave me an understanding that they would benefit from having a further cognitive evaluation. Okay. So beyond the cognitive processing, we can also assess someone's hygiene by looking at their feet. Okay. I'm talking, look at those toes. Are they, are they dry and crusty and no one's putting lotion on them? Are they moisty because they're getting wet in the shower, but they're not actually getting washed? And no one's taking the time to actually dry between their toes. And so they're just getting wet, not dried, and slammed into some socks and shoes. And now they're at risk for infection and skin breakdown because it's all moist. And then they're in their shoes all day long. So check those toes. I want you to also check their toenails. I have had multiple patients that some are cognitively sound, some have some cognitive impairment, and both parties oftentimes have toenails that are so long, they're hitting the front of their shoes and causing them pain, which is ultimately impairing the interventions I want to work on with them to increase their strength, their endurance, and all of the good things to build their reserve and resiliency. But we're limited because your patient is is impaired by their pain from their toenails hitting their shoes. Super low-hanging fruit. Can we get them set up with, a pedicure? Can we talk to family about helping with nail care? Do they live at a facility where nail care would be offered? Is there a podiatrist that rounds at the facility, or is there one that they could get in with and get some foot care? We have someone in my hometown where all she does, she's a skilled nurse, and all she does is cut people's toenails all day long. And so there's lots of options where someone could have this completed for them. If it becomes the washing and drying their feet, that's an intervention we can work on with our patient. Is there that skin breakdown? We can maybe stop an infection from getting worse by notifying the correct people if we notice that there's that breakdown or cracking in the skin and we need to get ahead of something before something worsens. Then, so we've talked about physical ability, cognitive processing, overall hygiene, and then we can talk about also ultimately looking at people's feet. You might see some deformities. And what I mean by that is maybe your patient has some sort of a bunion that sticks out that impairs their ability to wear certain shoes. And you could recommend some different shoes that have a wider toe box that don't squeeze their feet. And so they don't have pain and they're more likely to participate in your interventions because they're not hurting while they're standing or walking. Do your patients potentially have missing toes? I have more than a handful of patients who have multiple toes that have been amputated for multiple different reasons. Some, yes, were diabetic. Some just started to develop deformities where one toe was overlapping the other. And the best intervention for them was to literally amputate the toe. However, it takes a little time for that patient to regain their balance and stability with that missing toe. So learning a lot about your patient just by looking at their feet, looking at their toes, looking at the actual structure. We talked about this a little bit in the foot hygiene sides of things, but are there deformities such as those hardenings or calluses that have formed like on the bottom or the sides of their feet? Have they been removed? And does your patient understand how they can actually like manage when their skin or that hardened area when it's been removed? What I mean by that is I had a different patient one time. She had a hardened area. It got removed. And so what we did was, as an intervention, taught her how to soak her feet, get that all set up, carry the water over, get it all set up, bending down to the ground, working on our balance and stability in a dynamic situation, soaking our feet for a little while, working on our upper extremity and core strength as she used a pumice stone to scrub the bottom of her feet to maintain that removed or that area where the hardened callus or corn had been removed. So low-hanging fruit and great ways that we can integrate interventions for our patients to maintain their independence just by looking at their feet. Just by looking at their feet. Okay. Again, if then go to. If there's issues with physical ability, then we know what we can do. We have all these different interventions. If there's challenges with cognitive processing, does that trigger a cognitive eval? Hygiene, be the resource dealer here. Okay, talk to other people in terms of caregivers, schedule with podiatry, call the foot care clinic. If there's deformities, if there's missing toes, then I want you to recommend changes in footwear or helping with processing hygiene techniques such as using a pumice stone. Overall, we can learn a ton just by looking at our patient's feet. Finishing off, I just want to mention Isley et al. In 2020 conducted a systematic review to look at the correlation between foot disease and foot problems and physical function in older adults specifically. What was found is that foot problems or foot disease was correlated to lower overall physical function. And after reviewing all of what we can learn and what we may find by looking at our patient's feet, I can totally see where that falls in. If my patient's in pain or they have this shooting sharp pain because they have that hardened area, of course they might have lower physical function because they might be less likely to participate in activities that cause that pain or cause them to hit that hardened area. What the systematic review also found was that foot pain has been associated with increased falls, reduced ADL independence, and poor balance. All of three very, very heavy hitters for us occupational and physical therapists. So I will leave you with this. Ultimately, it doesn't take a long time, but it could make a world of a difference. And I encourage all of you to take a second and look at your patient's feet. Thank you so much for joining me. I hope all of you will take the time, check out those feet. If you want to learn more, please follow us on Instagram. Please check out the ICE Physio app where you can learn all about this amazing process of serving older adults and all of the other lovely individuals in our physio world. Thank you all and have a wonderful night.